What does it take to become a heart surgeon? Age 18. You graduate high school. You tell people you want to be a heart surgeon. They say, wow. You don't tell them you just committed to 14 years of training before you'll be trusted to touch a beating heart. Right now, the only heart you've dealt with is your own, after a breakup you didn't see coming. Salary, $0. Age 22. Pre-med done. 4 years of biology, chemistry, organic chemistry, and physics. You've memorized more molecular structures than conversations you've had with friends. They went to parties. You went to the library. Salary, $0. Age 23. MCAT. 1 exam, 8 hours. You need a score high enough to land one of the most competitive medical school seats in the country. You score in the 96th percentile. You exhale for the first time in 6 months. Then you remember what comes next. Salary, $0. Age 27. Medical school graduate. 4 years of learning every system in the human body. You can name every artery, every valve, every chamber of the heart from memory. You still haven't operated on a living patient. Student debt, $350,000. Age 32. General surgery residency. 5 years, 80-hour weeks. You've operated through the night so many times, your body no longer knows the difference between 3 p.m. and 3 a.m. Most surgeons stop here. You're not most surgeons. Salary, $68,000. Age 35. Cardiothoracic surgery fellowship complete. 3 more years. You've learned to operate on a heart while it's still beating. You've repaired valves thinner than paper, bypassed arteries smaller than a pencil tip, replaced aortas that were seconds from rupturing. Salary, $80,000. Age 36. Attending cardiac surgeon. First solo open heart surgery. You crack the sternum. You open the chest. A human heart is beating right in front of you. You stop it. You work. For 5 hours, you operate in total silence. You restart the heart. It beats. The patient wakes up. Their family is crying in the waiting room. You walk out and tell them it went well. Then you sit in the hallway alone for 10 minutes because your hands are still shaking. Salary, $500,000. Age 45. Established heart surgeon. You've performed hundreds of open heart surgeries. A man in his 40s comes in with heart failure. Without a new heart, he has weeks. A donor match comes at 2 a.m. You drive to the hospital, transplant the heart, and he wakes up the next morning with a second chance at life. Salary, $800,000. Age 55. You're training the next generation. A fellow watches you operate and asks how you stay so calm. You tell them the truth. You're not calm. You've just learned that the heart doesn't care about your nerves. It only cares about your hands. So you trained your hands for 14 years until they stop shaking. Salary, $1 million.